eligibility, and that's some of the efforts that we're engaging in right now. Do we have other questions from press in the audience?
Hi, it's Sarah Cliff with Politico. Thanks for taking my question. I was wondering if you could talk a little bit about the research you're publishing today, research you've done previously, and how that informs, as you go about enrolling about 30 million people in health reform programs, how what you've learned about the CHIP program is going to help inform your understanding of how to enroll other folks as you kind of engage in this larger effort.
So I'd say there are two parts to that. There's a research answer, which is I think this new data source will help states prepare for where the large increases in enrollment are going to be and where increases in demand for coverage so that they can be prepared and have their enrollment and outreach systems up and ready. But I think there are many lessons from Medicaid and CHIP outreach and enrollment retention efforts for children that states will be able to take advantage of in the coming years.
In terms of the anticipation of 2014, when there'll be an opportunity not only for many more adults to enroll in Medicaid, but also to participate in state-based exchanges, we're beginning to look at the methods that have been very helpful in the CHIP outreach program. So a seamless enrollment system where the eligible person wouldn't have to figure out what program they qualify for, but just can enter a door and then have a system that automatically helps them enroll in the appropriate program. We know that other benefit categories may be helpful, so if you're signing up for one set of benefits, to be able to be reminded that you also will qualify for health insurance is enormously helpful. And we've begun to work. We had a very productive meeting with state teams and met with governors about beginning to have exchange discussions in states around the country. And enrollment is going to be a really key issue. So there are already planning grants that are anticipated going out this year so people can begin to build a system where for the American public, their enrollment will be pretty seamless. They won't have to sort through. And right now, I think, again, I would remind folks that we have a great new website, healthcare.gov, where easy to use, easy to access information is available about what's currently available to both adults and families in terms of both public and all the private programs in the market that are sold in that demographic to that group with some information. Later this fall, we'll have